Severe acute respiratory distress syndrome is a severe life-threatening medical condition characterized by widespread inflammation in the lungs. It is a disease of the lung parenchyma that leads to impaired gas exchange.
What is acute respiratory distress syndrome? Acute respiratory distress syndrome is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the bloodstream. What are all the causes that can lead to acute respiratory distress syndrome? Acute respiratory distress syndrome can be caused by trauma, sepsis, shock, gastric aspiration, uremia, acute pancreatitis, or amniotic fluid embolism. Describe the pathogenesis of acute respiratory distress syndrome. In acute respiratory distress syndrome, one of the causes that we just mentioned is going to cause diffuse alveolar damage and increase in alveolar capillary permeability. Now, when there is an increase in the alveolar capillary permeability, there is going to be a leakage of protein-rich material along with neutrophilic substances into the alveoli. This protein-rich material is going to cause the formation of the intra-alveolar hyaline membrane, and the neutrophilic substance is going to cause damage to the alveolar wall. So basically, in acute respiratory distress syndrome, there's going to be high amounts of fluid that will end up getting into the alveoli and cause damage there.
The lung damage can be direct or indirect. Direct causes: breathing in smoke or poisonous chemicals, breathing in the stomach contents while throwing up, and pneumonia. And indirect causes are bacterial blood infections, drug overdose, having many blood transfusions, heart-lung bypass, and severe heat to the chest or head. Signs and symptoms: rapid breathing, feeling like you can't get enough air in your lungs, and low oxygen levels in your blood, which can lead to organ failure, and symptoms such as rapid heart rate, abnormal heart rhythms, confusion, and extreme tiredness.
Hello, my name is Wes. Today we're going to talk about a couple of signs and symptoms of respiratory distress. Some of the basic signs and symptoms of respiratory distress are as follows. Nasal flaring, guppy breathing, suprasternal retractions, intercostal retractions, accessory muscle usage, cyanosis, which means when the skin turns a bluish color. Although in dark-skinned individuals, the main part of their skin often turns gray, ashen, or waxy in appearance. If the individual exhibits agitation or restlessness, or if they have a sense of impending doom. I think I'm fitting to die.
The treatment: there is no targeted treatment specifically for ARDS. The medical team will support the patient until the lungs improve on their own. Depending on the state of the patient, an oxygen mask will be used, or a breathing machine. Nutrients and fluids will be supplied through a tube that goes into the patient's nose and down to his or her stomach. Antibiotics will be administered if the cause of ARDS is an infection. Related diseases: pneumothorax. is an abnormal collection of air gas in the pleural space that separates the lungs from the chest wall. Like pleural effusion, pneumothorax may interfere with normal breathing.
During normal respiration, the lungs expand and contract within the chest cavity. The lungs are encased by two layers of tissue, similar to a fist that has been pushed into a balloon. The space between the layers, called the pleural cavity, is lubricated so that the lungs can slide comfortably across the chest wall. If air enters this space, it is referred to as a pneumothorax. One type of pneumothorax, called a traumatic pneumothorax, can be caused by injury to the chest. A blunt or penetrating chest injury can cause a small tear on the surface of the lung, allowing air to enter the pleural cavity and to become trapped. The pocket of air produces excessive pressure on the lung, causing it to collapse. A spontaneous pneumothorax occurs without injury as a result of certain lung diseases, such as asthma, emphysema, or COPD. Small air-filled sacs called blebs can form on the lungs. If the blebs rupture, they can release air into the pleural cavity. Pressure from the trapped air causes the lung to collapse. However, a spontaneous pneumothorax can also develop in a person with no obvious risk factors or disease. This condition is more common in smokers and in men between the ages of 20 and 40. A tension pneumothorax is a serious complication that can develop with any pneumothorax. If the pocket of trapped air cannot escape, it continues to grow. The increased pressure in the pleural cavity can push the heart and major blood vessels to the other side of the chest. When this shift takes place, it causes a significant drop in blood pressure. This is a life-threatening.
Pulmonary fibrosis is the formation or development of excess fibrous connective tissue in the lungs. It is one of the restrictive conditions of human respiratory disorders. The symptoms are shortness of breath, particularly with exertion, chronic dry, fatigue and weakness, chest discomfort, and loss of appetite and rapid weight loss. Ventilator-associated pneumonia is a subtype of hospital-acquired pneumonia which occurs in people who are receiving mechanical ventilation. It is not characterized by the causative agents. Rather, as its name implies, its definition is restricted to patients undergoing mechanical ventilation while in a hospital.
Ventilator-associated pneumonia, or VAP. Introduction. VAP stands for ventilator-associated pneumonia. VAP is a lung infection or pneumonia that develops in a person who is on a ventilator. Patients and healthcare providers should be extra careful to prevent VAP. A VAP infection could be fatal. It is estimated that about 15% of hospital-associated infections are pneumonia. If you or your loved one is on a ventilator, you need to learn how to prevent VAP. Preventing VAP is always better than treating it. This program explains what ventilator-associated pneumonia is. It discusses its causes and how to prevent it. Pneumonia. Pneumonia is an inflammation of the lung. Inflammation is the immune system's normal response to infections, injury, or contaminants. Germs, bacteria, and viruses are organisms that can cause lung infections or pneumonia. For the purposes of this program, Ventilator-associated pneumonia, or VAP. Introduction. VAP stands for ventilator-associated pneumonia. VAP is a lung infection or pneumonia that develops in a person who is on a ventilator. Patients and healthcare providers should be extra careful to prevent VAP. A VAP infection could be fatal. It is estimated that about 15% of hospital-associated infections are pneumonia. If you or your loved one is on a ventilator, you need to learn how to prevent VAP. Preventing VAP is always better than treating it. This program explains what ventilator-associated pneumonia is. It discusses its causes and how to prevent it. Pneumonia. Pneumonia is an inflammation of the lung. Inflammation is the immune system's normal response to infections, injury, or contaminants. Germs, bacteria, and viruses are organisms that can cause lung infections or pneumonia. For the purposes of this program, pneumonia will refer to an infection of the lungs. When a person has pneumonia, lung tissue can fill with pus and other fluids. This makes it hard for oxygen to reach the bloodstream. With pneumonia, a person develops a cough and fever, and it might be hard to breathe. How serious a pneumonia is depends on several factors. The patient's overall health and the type and extent of the pneumonia are important factors. If you are young and healthy, your pneumonia can almost always be treated successfully. If you are older, have heart failure or lung disease, your pneumonia could be harder to treat. With these factors, you are also more likely to develop complications. Some complications can be fatal. Babies and people 65 years of age and older have a higher risk of getting pneumonia. Other people at increased risk include people who have immune deficiency diseases, such as HIV or AIDS, have chronic illness, such as cardiovascular disease, emphysema, or diabetes, smoke or abuse alcohol or drugs, are exposed to toxic fumes and pollutants. VAP. The nose, the back of the throat, and the breathing tube, also called the trachea, help filter germs coming into the lungs from the air we breathe. Cells and mucus help trap these germs and push them out from the lungs before they reach too far into the lungs. A ventilator is a machine that helps a patient breathe by giving oxygen through a tube. The tube is placed in the patient's breathing tube, or trachea. It can be placed through the mouth, nose, or through a hole in the front of the neck known as a tracheotomy. The tube is connected to a ventilator. When a mechanical breathing tube is placed to help with breathing, it causes important defenses to be bypassed, which increases the risk of infection. There are more than 50 kinds of pneumonia. Pneumonia that people get infected with at the hospital or a healthcare facility is known as hospital-acquired pneumonia or nosocomial pneumonia. This is a serious infection that can be fatal. Nosocomial pneumonia usually affects patients who are on a mechanical ventilator, in the intensive care unit, or have a weak immune system. A VAP is usually a special type of nosocomial infection. It happens in patients who are on a ventilator or respirator. A VAP can also happen if a patient is on a ventilator at home. A patient may need a ventilator when he or she is very ill or during and after surgery. Ventilators can be life-saving, but they can also increase a patient's chance of getting pneumonia by making it easier for germs to get into the patient's lungs. A ventilator-associated pneumonia, or VAP, is a lung infection or pneumonia that develops in a person who is on a ventilator. Prevention, staff.